My name is Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that supports those living with lupus, overlapping conditions, their families, and caregivers. I learned about lupus right a little bit before my sister was diagnosed with it. There was not a lot of information about it. However, I had to learn really quickly what all the symptoms were and all the complications. In 2009, my sister was diagnosed with lupus. She almost lost her life. If she wouldn't have advocated for herself, she would have died that night. It has been a journey. However, it is something that we are really blessed and lucky to know that she was actually not only diagnosed in the emergency room, which is really not that common. A lot of people don't get a diagnosis early enough, and sometimes it is too late. It takes approximately 2 to 6 years to get a diagnosis. So we were very fortunate for her to get that diagnosis that day, and also was able to survive. My sister is a woman. She is a Hispanic Latina woman. And I think women in general, we tend to get less, I don't want to say attention, but perhaps even statistics have shown that we don't get the same level of care or immediate care as men. So the fact that my sister was a woman, that she was Latina Hispanic, I think did play a role with her getting her diagnosis. Because even though she got a diagnosis that day that she went to get care, it took a lot for her to get heard, for her to get the care that she needed. She was first dismissed, and it wasn't until she persisted and insisted that she was able to get the doctor's attention and get some immediate lab work, which at that time was really what was a decision maker for the provider. A patient knows their body. A person knows what they're going through. And I think it is very important to believe the patient. What is a caregiver? We tend to think that a caregiver is someone that you hire, a nurse, maybe someone that provides, a lot of the accessibility, taking you to and from doctor visits, maybe infusing your medications or giving you the medications, bathing you. And a lot of times that's like a huge misperception, because a lot of our family members become caregivers, right? And we don't have the special training. We just have to automatically take on that role. And that's really what happened to me. I'm the only one in my family that works in healthcare. So automatically, and I'm the second woman, the eldest of my siblings. So I kind of took that role immediately. So as a caregiver, one of the things that I had to do was learn about the condition, learn how to advocate for my sister, learn about the treatments, and be there for her emotionally, and also to be there with her throughout the journey. My advice for caregivers and loved ones is to educate yourself, learn about the condition, learn about lupus or any condition that your loved one may have or that you may have. Learn about the treatments, learn about how you can help communicate and build that trust with your loved one that you're caring for, and also how to navigate healthcare